and support to its stakeholders. Having celebrated 74th year of its foundation day on July 4th this year, today is yet another momentous day. I, Sonal Mahajan, Head Projects, welcome you all to introduce you to a unique initiative launched by the group titled the DCM Cares Talk Series, which is an extension of the DCM Cares Community Outreach Program. Through DCM Cares, the group strives to reach out to the society at large through many benevolent measures. In these unprecedented times, when our classrooms have reached the homes of the students, we are also attempting to reach out to each one of you in the best possible ways. Through DCM Care Talk series, we would like to assuage your concerns by speaking to you on topics pertaining to mental and physical well-being. Our speakers would include renowned counselors, clinical psychologists, doctors, and other professionals who would help us all sail out of these trying times of COVID. On its debut, I take immense pleasure in introducing you all to Ms. Shaina Vohra, a physiotherapist by profession and associated with the reputed Amandeep Group of Hospitals. A pass out of the Guru Nanak Dev University, Ms. Vohra's expertise lies in advanced physiofit physiotherapy, clinical and sports injuries. She is here amongst us to speak on the importance of staying fit and how to manage knee pain and injury. Ms. Vohra, I welcome you and kindly take the baton.
Good afternoon, everyone. This is here Dr. Shaina, physiotherapist at Amandeep Group of Hospitals. Thank you so much, ma'am, for the welcome. So today, here I'm all to address you all on the topic knee pain and rehabilitation. Presentation. So before starting with the knee pain, I would like to introduce with you about knee joint. So this is how your knee joint is. It is composed of the femur, which is your thigh bone, and the tibia, which is your lower leg bone. The bones of knee joint, it consists of distal femur. This is the thigh bone with its two condyles, the one condyle and the other condyle, and the proximal tibia, which is your lower leg with its two tibial plateaus, the one plateau which is on the medial side and the other which is on the lateral side, that is outer side. Now medial is inner side and lateral is on the outer side. And the large sesamoid bone in the quadriceps tendon, which is called the patella, jise aap log bolte hain knee cap. Now the joint capsule, it encloses two articulations, the tibiofemoral and the patellofemoral articulation. You can see this is the femur, which is your thigh bone, the tibia, which is the bone in the lower leg, and this is the fibula, which is bone on the outer side. And this is the patella, which is called the kneecap. Now the tibia and the femur, they make the tibiofemoral joint, and the patella and femur, they make patellofemoral joint. Next slide, where to move. Okay, the tibiofemoral joint. Now this knee joint is a biaxial joint. Now what is biaxial? It means it moves in two axes. The modified hinge joint. Hinge joint is, that is, it moves in 2 degrees of freedom. That is, 2 movements are possible here. The flexion, जैसे बोलते हैं knee घुटना मुड़ना, and the extension, that is straightening of the knee, कि जब आपका knee घुटना सीधा है. Now it is interposed with the menisci, which are supported by the ligaments and the muscles. The menisci are present here, which are acting as a shock absorber. मतलब जैसे आपका सीधा weight पूरी body का जो आपके knee joint पे आ रहा है, उसको बचाने में help करना वो कौन करता है? Menisci. And it is supported by the ligaments, which you can see. These are the ligaments which are present. Here also the ligaments are present. These are coronary ligaments and the muscles which are there. Muscles here which is supporting, that is called as quadriceps, which is very important muscle to support the whole knee joint during the walking. Anteroposterior stability. Anteroposterior stability is, that is stability which is from front to back. That is provided by the cruciate ligaments which are present here. The mediolateral stability, that is stability from the medial side, the inner side and to the outer side. It is supported by the medial and lateral collateral ligaments. The menisci, which are present here, they basically improve the congruency of articulating surfaces. Now, what is articulating surfaces? That is, जो joints मिलके, जो दो bones मिलके joints बना रही हैं, उसको हम बोलते हैं articulating surface. Congruency मतलब कि उन दोनों में आपस में जुड़ा रहना, उसको बोलते हैं congruency. Now, they are connecting to the tibial condyles and capsule with the help of coronary ligaments and patella via the patelomeniscal ligaments. Patellofemoral joint. The patella, which is a sesamoid bone in the quadriceps tendon. You can see here. So this is a femur and this is a patella. They make the patellofemoral joint. This is a quadriceps tendon. As I have already told you, the very important muscle that is important for walking, that is a quadriceps muscle. So the attachment of quadriceps muscle with the patella, so this is called as quadriceps tendon. The patellofemoral joint, it is composed by patella and femur, and this patella, it is also called as a kneecap. It articulates with the intercondylar groove. Now this is an intercondylar groove which you can see here. That is दो condyles के बीच में जो opening है उसे हम बोलते हैं intercondylar groove. जब आपका knee flex करता है, that is this one. So इसमें सबसे पहले क्या होगा कि जो patella है वो enter करेगा and it slides caudally. That is it moves downward direction. और जैसे ही एक्सटेंशन होता है मतलब फिर से पटेल ये सीधी होती है, दैट इज आपका जो घुटना है वो सीधा हो जाएगा, तो जो पटेला है वो फिर से ऊपर आ जाएगा. सो अगर पटेला मूवमेंट रिस्ट्रिक्ट हो जाती है, मतलब पटेला मूवमेंट नहीं होती है, तो वो इंटरफेयर करती है आपकी नी फ्लेक्शन के साथ, जिसकी वजह से क्या होता है एक्सटेंसर लैग, जो कि हम आगे डिस्कस करेंगे. Very important, joint hypomobility. So now we are going to discuss about the knee pain points, that is what are leading to the knee pain. Joint hypomobility. Hypomobility. Hypo means decreased, mobility means movement. Very important first thing is osteoarthritis. I think all of you have heard about osteoarthritis. हड्डियों का आपस में रगड़ना, उसे बोलते हैं osteoarthritis, leading to osteoarthritis. So osteoarthritis is referred to as a degenerative joint disease. What do you mean by degenerative? That is कि जब दो हड्डियां आपस में रगड़ रही हैं, this movement, it is leading to degeneration of the bones. So it is very most common disease which is affecting the weight bearing joint. All of you know that the knee joint is basically the weight bearing joint, which is actually carrying the whole weight of your body. Articular cartilage destruction, typically which is more present on the inner side as compared to on the outer side of the knee. Articular cartilage destruction, cartilages जो कि help करते हैं support के लिए, उसका destruction हो जाना जो कि ज़्यादा किधर present होता है अंदर वाली side से as compared to the on the outer side. You can see on the X-ray, this is a normal joint space which is present between the femur and the tibia. But when there is a osteoarthritis, there is a loss of joint space, which I have told you, which is more present on the medial side, मतलब अंदर वाली side पे ज़्यादा होगी as compared to बाहर वाली side पे. Now, what are the basically features which are present in which case you can see it is present more among the old age people, that is above 65 years, it is more prevalent. It is present in the women more as compared to males. It is present in the women or the ladies or any other person who are excessive weight. So weight is actually a big issue which is leading to osteoarthritis. What will be the symptoms? The pain. सबसे पहले दर्द होना. The muscle weakness. जो muscle है वो आपके कमजोर हो जाएंगे. जो medial side है, again मतलब ये वाला side, जो अंदर वाला side है, उसमें joint जो है वो loose हो जाएगा. And the limitation of joint motion. आपका जो joints का motion है, joint का movement है, वो कम हो जाएगा, which will affect the function. आपका daily movements को भी restrict करेगा. Deformities such as genu varum commonly develop in the knees. I will discuss about with this deformity, that what kind of deformity you will see. I'll cover it in the next slide. Knee instability. You must have heard about the lady saying, "मेरा घुटना बाहर को आ रहा है." So it is also frequently reported by individual with knee osteoarthritis. So leading to instabilities is there. चलते चलते घुटना बाहर को आ रहा है. This is called as a knee buckling. It is common with osteoarthritis. Now, what are the factors which are leading to osteoarthritis? Is excessive weight. So reduce the weight. Joint trauma, any kind of injury can be there. It can be direct injury, indirect injury. The developmental deformities can be there. the weakness of your quadriceps muscle, which is very important muscle, and the abnormal tibial rotations. So they are basically the risk factors which are there for developing osteoarthritis. Second is rheumatoid arthritis. You all have heard about गठिया. So जो rheumatoid arthritis है वो सबसे पहले आपके अफेक्ट करता है हैंड्स को, आपके फीट को, लेकिन जैसे जैसे ये डिसीज बढ़ता जाता है द नी जॉइंट इज आल्सो इन्वॉल्व। इसमें और ऑस्टियोआर्थराइटिस में आप कैसे डिफरेंशिएट करेंगे? ऑस्टियोआर्थराइटिस यूजुअली प्रेजेंट होता है 65 इयर्स से ऊपर के एज में, बट रूमेटॉइड आर्थराइटिस कैन बी प्रेजेंट फ्रॉम 15 इयर्स टू 55 इयर्स ऑफ एज। ऑस्टियोआर्थराइटिस में मोस्टली डिस्टल जॉइंट्स इन्वॉल्व होते हैं, बट रूमेटॉइड आर्थराइटिस में प्रॉक्सिमल जॉइंट्स पहले इन्वॉल्व होते हैं एज कम्पेयर टू डिस्टल जॉइंट्स। ऑस्टियोआर्थराइटिस में आपको कोई सिस्टमिक डिसऑर्डर्स नहीं प्रेजेंट होंगे, देयर विल बी नो सिम्पटम ऑफ फीवर, nothing like that, but in rheumatoid arthritis, yes, the fever is also present. The joints become warm and swollen, that is टेम्परेचर जो है वहाँ का एरिया का राइज रहेगा, बढ़ा होगा जब आप कंपेयर करेंगे दूसरी साउंड साइड से, मतलब जो आपकी साइड ठीक है उसके साथ जब कंपेयर करेंगे तो उस एरिया का टेम्परेचर जो है वो ज्यादा होगा। इट विल बी स्वॉलन आल्सो, सूजन होगा एंड लिमिटेड मोशन जो है, मतलब जो मूवमेंट है वो कम हो जाएगी। In addition, the genu valgum deformity occurs. So, in osteoarthritis, we discussed that there will be the genu varum deformity and the genu valgum, that is knock knees and the bow legs. So, this is the normal knees. Like when you are standing, this is the normal. When you are in the standing position, this is the normal knees which is present. That is how you are looking in the standing position. This is genu valgum, when your knees will be like this. So, this is genu valgum. And genu varum is when there is a gap which is present. So what are the signs and symptoms of rheumatoid arthritis? Intense pain, very much high full pain is there, loss of mobility, movements जो है वो कम हो जाएंगी, and there will be deformed joints. जो joints है उनमें deformities present होंगी. Obviously the genu varum deformity, the genu valgum deformity, which is this one, it is present in case of rheumatoid arthritis, and then genu varum, the deformity which is seen in osteoarthritis case. Next is post-immobilization hypermobility, the very big issue which is there. Now, when the knee or anything which has been immobilized, that is, it has not been moved for several weeks or maybe for more than that time, such as like post-fracture, you can say, after any surgery, you can say. So the basically the capsules, the muscles and the soft tissues, they develop contracture, मतलब वो क्या हो जाएंगे, टाइट हो जाएंगे। सपोज कीजिए आपका सर्जरी हुआ है और आपने नी जॉइंट को आपके सर्जन ने बंद कर रखा है और इस पे कोई मूवमेंट नहीं हो रहा है, तो ये क्या हो जाएगा, इसी पोजीशन में, किसी भी पोजीशन में वो फिक्स करके रख सकते हैं, तो वो उसी पोजीशन में फिक्स हो जाएगा। तो वो वहाँ पे जो टिश्यूज हैं, कैप्सूल्स हैं, वो डेवलप हो जाएंगे, कॉन्ट्रैक्चर डेवलप करेंगे, मतलब वो टाइट हो जाएंगे और वहाँ का मोशन क्या हो जाएगा, रिस्ट्रिक्ट हो जाएगा, मतलब मोशन विल बी लिमिटेड। सो एडिशंस क्या होंगी, वो रिस्ट्रिक्ट करेंगे कि जो आपका पटेला है वो भी मूव नहीं करेगा, उसकी कोई इंफीरियर मूवमेंट नहीं होगी, कोई सुपीरियर मूवमेंट नहीं होगी। अगर इंफीरियर मूवमेंट नहीं हो रही है, मतलब ये नी फ्लेक्शन जो है वो परमिट नहीं हो रहा है, और उसकी वजह से क्या होगा, एक्सटेंसर लैग में occur with active knee extension. I'll show in the next slide what is extensor lag. So it is mostly seen in the after operative repairs, maybe the repair of the any ligament is there, or the knee is immobilized in flexion for a prolonged period of time. So for that, I recommend that physiotherapy is very important post-operatively day 1 only, so that such kind of things are not seen or by the patient. Now, what are the common structural and functional impairments which are present? Now, when the joint involvement is there, the pattern of restriction at the knee is usually loss of flexion. सबसे पहले flexion जाता है, patient आएगा, मेरा घुटना मुड़ नहीं रहा है, as compared to that extension. Extension is okay, still okay, it is permitted, but there will be loss of flexion. So when there is a effusion is, that is the swelling is there, the joint will assume near 25 degrees of flexion, which you can see in the diagram here. That is कि 25 डिग्री में आपका घुटना जो है मुड़ा हुआ है, सो पोजीशन जहाँ पे कैप्सूल बहुत ज्यादा डिस्टेंडेड है, लूज है। सो इसमें क्या है कि आप जब घुटने को सीधा करने के पेशेंट को बोलेंगे कि वो घुटना सीधा करे, वो घुटना सीधा नहीं कर पाएगा, और जो इसमें 25 डिग्री का इतना फ्लेक्शन रहेगा जिसे हम बोलते हैं एक्सटेंसर लैग, कि कंप्लीट एक्सटेंशन पॉसिबल नहीं है। सो सिम्टम्स ऑफ जॉइंट इन्वॉल्वमेंट सच एज डिस्टेंशन, stiffness, pain, reflex quadriceps inhibition. So it may cause extensor lag in which active range of knee extension is less. Active range मतलब जब आप patient को खुद बोलेंगे कि knee extension करो और वो नहीं कर पाएगा, but it is available जब आप उसको extension करवाएंगे. Now, common activity limitations and participation restriction. So, what kind of activities are limited? With the acute symptoms, when you are in a very advanced stage of degeneration, मतलब अभी आपकी हड्डियां घिसना शुरू ही हुई है, तो क्या होगा कि मूवमेंट में पेन होगा, कि पेशेंट कहेगा मेरे को वॉकिंग नहीं मेरे से हो रहा है. The ladies, the old ladies, they will represent with कि मैं जब चल रही हूँ तो मेरे से चला नहीं जाता है, चलने में मेरे को बहुत दिक्कत है. वेट बेयरिंग, जब मैं खड़ी हो रही हूँ तब बहुत ज्यादा दिक्कत है, मेरे को मूवमेंट में दिक्कत है. वेट बेयरिंग एक्टिविटीज जैसे नीचे बैठने में, चेयर से उठने में, इसमें भी उनको दिक्कत होगी. कमोड सिटिंग में वहां पे भी बैठने में उनको दिक्कत होगा. स्टेयर्स चढ़ना, स्टेयर्स उतरना दोनों ही डिफिकल्ट रहेगी. झुकना, स्टूपिंग, दैट इज आगे झुकने में उनको दिक्कत रहेगा. एंड द स्क्वाटिंग मतलब नीचे बेंड करने में भी उनको प्रॉब्लम रहेगी. और जब एंड स्टेज ऑफ डिसीज हो जाता है, एंड स्टेज ऑफ आर्थराइटिस हो जाता है, तो फिजिकल एक्टिविटीज जो है वो बहुत ज्यादा कम हो जाएंगी. और इवन देयर विल बी reduction in or complete loss of the household activities, and the patient will be lying on the bed for the whole day. Now, how to manage these? So, management in the protection phase. When you are in the protection phase, that means yes, you can protect it from getting more damage. First of all, the very first important thing is control the pain and protect the joint. Now, हो सके pain को control करके रखो, joint को protect करो. अब उसमें क्या है? The physio and the doctor both can help. That is, they teach the patient about bed position. The very first thing is that how you will position your bed, how will you sit while, or how you are in lying position, what you will do. I'll suggest that you should always keep a pillow when you are in the sideline position. मतलब जब आपने पासा लिए रखा है तो आपके दोनों घुटनों के बीच में एक तकिया रहना चाहिए. So that is the first thing you can teach to your patient. यूज ऑफ स्प्लिंट क्यों यूज करना है? ताकि कोई भी कॉन्ट्रैक्चर डेवलप ना हो. रेंज ऑफ मोशन एक्सरसाइजेस हम आगे डिस्कस करेंगे, जिसमें हमारा फ्लेक्शन एक्सरसाइज रहेगा कि हमने मुड़वाना है, मुड़वाना है और घुटना सीधा कराना है. मसल सेटिंग एक्सरसाइज विल डिस्कस. इंस्ट्रक्ट द पेशेंट टू मिनिमाइज स्टेयर क्लाइंबिंग. हम पेशेंट को बोलेंगे कम से कम स्टेयर्स चढ़ो उतरो, कम से कम करो. और जिसमें हम उनको स्टेयर क्लाइंबिंग में भी रिहैब में बताएंगे कि जब स्टेयर्स चढ़नी है तब कैसे करना है और स्टेयर्स उतरते टाइम क्या यूज करना है. यूज एलिवेटेड सीट्स ऑन कमोड. जब आप कमोड सेटिंग कर रहे हैं, लोअर कमोड में आपको ऑब्वियसली वेट बेयरिंग ज्यादा होगा, there will be more pain. तो हम क्या बोलेंगे? that elevated seats यूज करनी है, deep seated या low chairs avoid करनी है, ताकि minimum stressful knee flexion रहे कि आपका घुटना ज्यादा ना मुड़े while bearing weight. Maintain soft tissue and joint mobility. Range of motion techniques रहेंगी, that is knee flexion and extension. Applied gentle joint techniques. Gentle joint techniques will be provided by your physiotherapist. The mobilization techniques, that is, which involves the gentle joint movements, the patellar movements, which I will discuss later. Now, what are the exercises technique to increase the flexibility and range of motion? हम सबसे पहले करेंगे कि हमने knee extension कैसे बढ़ाना है, कि अगर आपके patient का घुटना सीधा नहीं हो रहा है तो वो घुटना हमने सीधा कैसे कराना है. So first very important thing is PNF stretching technique. PNF stretching technique में क्या है? Patient आपका लेटा है and you will ask the patient to bend the other knee and then ask him to extend the knee. मतलब घुटना सीधा ऊपर लेके जाना है and ask him to contract his muscle. That is, just take a push and you, the physiotherapist, will apply the resistance in the opposite direction. That is, he will place the hands over the knee as it is shown in the picture, and then the patient will take it towards his side, towards his chest, and the therapist will apply the force in the opposite direction. Second, you can perform this gravity-assisted passive stretching technique. Now, what does this stretching technique means? You will ask the patient to lie on his stomach, ulte let jana hai, and then ask the patient to dangle his legs on the floor. And very important is to place a pillow or any kind of rolled towel under the patella, under this knee, so that to prevent any patellar compression. And ask him to just keep the legs dangling over the floor. So it will be a very good stretching technique which will be provided by your gravity. So it will be a gravity-assisted passive stretching technique. Next is exercises to increase knee flexion. जैसे कि बोला कि पोस्ट इमोबिलाइजेशन, जब आपका मतलब काफी देर तक घुटना बंद रहा है, आपने मूवमेंट नहीं किया है, तो उसके बाद आपका नी जो है वो फ्लेक्शन स्टेज में नहीं आ पाता, देयर विल बी द डिफिकल्टी इन द नी फ्लेक्शन. सो हाउ टू इंक्रीज दैट नी फ्लेक्शन? First is PNF stretching technique. Ask the patient to lie in the sitting, the patient will be in sitting position. Ask him to just keep the legs lower, and then tell him to press the knee down, and the therapist will apply the force in the opposite direction. The second thing is gravity assisted supine wall slide. In this, you will ask the patient to keep the other leg straightened and bend the knee and then just slide it over the wall. So this is gravity assisted, again, stretching technique, which is very beneficial to increase the knee flexion. To increase the mobility of IT band. So what is IT band? It is basically the iliotibial band. We all forgot to even increase its mobility, but it is very important to provide the proper patellar movement and also improve the knee flexion. So this IT band, which is iliotibial band, which is present at the site of pathway of the thigh, so it is not easily stretched. So its mobility is also very necessary for the movement, for the patellar movement also, and for the knee flexion also. So how you will increase its movement is, you will take one foam roller. You will ask the patient to just slide this foam roller in the forward direction, in the backward direction. That is back and forth movement of the foam roller. It will provide the stretching as well as the facial release of the IT band. Next is exercises to develop and improve the muscle performance. How you will improve the muscle performance? I told you there are very two important muscles, the quadriceps and the hamstring muscle. The quadriceps muscle is very important, which is actually will help you in the walking. So it is a knee extensor, and the hamstring muscle, which is present at the back of your thigh. Quadriceps is present at the front of the thigh, which is a knee extensor. That is जो आपके घुटने को सीधा करेगा. The muscle which is present here, that is a quadriceps muscle, or the muscle which is present at the back of the thigh, which will help in the knee flexion, that is a hamstring muscle. So how to improve the strength of quadriceps is, first is quad sets. You will ask the patient to be in the lying position. Patient later place a rolled towel under the knee and ask him to contract his muscle. That is, just press down the knee in the downward direction, hold it for 5 seconds and then repeat. Relax, repeat. Contract, relax repetitions will be there. So this is called as a quad sets. Second is straight leg raise. In this, you will ask the patient to be in the lying position. The other knee will be bent, and then you will ask the patient to extend his knee. मतलब टांग ऊपर उठाना है सीधा, and then पैर को अपनी तरफ अंदर की तरफ खींचना है. Hold it for 5 seconds and then again relax. Now, how to develop the strength of hamstring, which is important knee flexor. So you will ask the patient first as hamstring sets. In this, the patient will be in the lying position. Patient लेटा हुआ है. You will ask the patient to just bend his knee little bit, and then where in the previous exercise we were doing asking him to press down the knee, here we will ask him to press down the heel in the downward direction. Second will be hamstring curls. The patient is in the prone lying position, matlab he will be on his flat stomach. You will ask the patient to bend his knee and then take it downward. Bend his knee and take it downward. So this is hamstring curls. Next is patellofemoral dysfunction. We have discussed about the patellofemoral joint earlier. Now it is very common among the people who have the injury. The injury can be the direct injury over the knee, or it can be indirect injury. They have the anterior knee pain. They will say, complain about that we have the pain over this region, over the anterior knee pain. So that is called as a patellofemoral knee pain also. That is patellofemoral pain syndrome I have mentioned here. So it may be due to the direct trauma, any direct injury, the overuse of the knee. There may be the faulty patellar tracking. That is, जो पटेला का मूवमेंट है वो प्रॉपर नहीं हो रहा है, वो किसी भी वजह से हो सकता है कि आपका पटेला जो है वो शिफ्ट हो चुका है. सो इम्पेयरमेंट्स जो एसोसिएटेड हैं पटेलोफेमोरल डिस्फंक्शन के साथ, दैट इज पेन रहेगा पटेलर रीजन में, पटेला लॉक हो जाएगा, जिसे बोलते हैं लॉकिंग ऑफ द नी, कि घुटना बंद हो गया, लॉक हो गया. और देयर मे बी द स्वेलिंग एट द नी, सूजन रहेगा. पटेलर ट्रैकिंग जो है, पटेला का मूवमेंट, ट्रैकिंग इज पटेला का जो मूवमेंट है वो प्रॉपर नहीं रहेगा. जो लोअर एक्सट्रीमिटीज की अलाइनमेंट है वो चेंज हो जाएगी, कि आपका जो टिबिया है उसकी रोटेशंस होंगी, जिसकी वजह से आपका जो लोअर लेग्स है उनकी अलाइनमेंट चेंज हो जाएगी. देयर विल बी इंक्रीज्ड हिप एडक्शन, जो हमने पहले वाल्गस डिफॉर्मिटी आपको दिखाया. वो डिफॉर्मिटीज में प्रेजेंट होगी। एंड देयर विल बी डिक्रीज मीडियल ग्लाइडिंग, जब आप पटेला को मूव करेंगे तो पटेला अंदर की तरफ मूव नहीं होगा। प्रोनेटेड फुट, नाउ व्हाट इज प्रोनेटेड फुट इज कि जो फुट है वो आपका बाहर की तरफ रहेगा, पेशेंट का जो फुट है वो बाहर की तरफ रहेगा, इट विल बी नॉट इन द न्यूट्रल पोजीशन, सेंटर में नहीं होगा। Patellofemoral symptoms को आप मैनेज कैसे करेंगे? The physiotherapist will help here in the mobilization of the patella, that is medial gliding of the patella. Very important for the patellar tracking when you have to just mobilize it, or you can also perform this mobilization in case of patellar restrictions. And if the patellar restriction is there, then yes, the knee pain will be there. So medial gliding of the patella or the lateral gliding, the patellar mobilization is very important, which should be in the gentle way. VMO strengthening. Now, what is VMO? It is vastus medialis obliquus muscle. This muscle is very important, which will prevent this anterior knee pain. So you have to strengthen it. In the first picture, you can see that the patient is in the standing position. You will ask the patient to just keep a ball in between their legs and ask him to press it. You have to press the ball in between your thighs. Then in the advanced stage, you can ask the patient to press the ball and then perform the squatting position. That is wall squats. Total knee arthroplasty. Now, what is total knee arthroplasty is? You can see here in the radiographic picture. This is TKR. That is कि आपका जो knee है, घुटना दोनों change हो जाएंगे. That is total knee arthroplasty. Now, how to manage it? First of all, the maximum protection phase is there, which is for week 1 to 4. That is for the first 4 weeks. What will be the management in that case? पेन मॉड्यूलेशन मोडालिटीज की जो आपकी पेन को प्रिवेंट करे, ऐसी मोडालिटीज रहेंगी जिसमें जनरलाइज आपका टेंस कैन बी हेल्पफुल, द आईएफटी कैन बी हेल्पफुल, कंप्रेशन रैप, पेशेंट की बैंडेजिंग किया जाता है एफ्यूजन को कंट्रोल करने के लिए, स्वेलिंग को कंट्रोल करने के लिए। एंकल पंप्स विल बी देयर टू मिनिमाइज द रिस्क ऑफ डीवीटी। डीवीटी इज डीप वेन थ्रोम्बोसिस। जब आपका लेग्स जो है, जब आप मूव नहीं कर रहे हैं, एक ही पोजीशन में रहेगा, तो देयर इज अ हाई रिस्क फॉर द डीवीटी formation. So to prevent that, to minimize that risk, ankle pumps, that is just movement of the ankle forward, backward, is very important. Active assisted range of motion. Active, that is patient will perform on his own. Assisted with little help. Range of motion exercises, that is knee को bend करना और knee को straight कराना. ये range of motion exercises बहुत important है. And the active muscle setting quadriceps, which we have already discussed, that the quadriceps, hamstrings, we have discussed the hamstrings and the adductors in the VMO strengthening. Patellar mobilization, in the previous slide I have already discussed about the grade 1 and grade 2 patellar mobilization, the patellar gliding, which is important. The second is moderate protection phase, which is from week 4 to 8. We will perform patellar mobilization, the closed chain strengthening exercise. Closed chain exercises is when your distal, that is when your lower movement, when your lower foot is on the ground and you are moving, that is like wall squat, so that is a closed chain exercise. Proprioceptive training. Proprioceptive training मतलब जिसमें आपका जैसे after surgeries there is a high risk कि patient का जो loss हो जाता है proprioception loss of sensation, loss of touch is there. So yes, you will give the proprioceptive training. Physiotherapist will help a lot in proprioceptive training also. Protected aerobic exercises. Aerobic exercises के लिए highly recommended रहता है, but it should be in the protected form. It should not be in the excessive. Swimming can be there. Cycling, highly recommendable, and the walking. Minimum protection phase. Minimum protection phases, that is you need not to worry. Now it is that you have to just return back to your functional phase. So it is beyond week 8. The first of all the things, the rest of the management will be continued as a previous phase. Now the physiotherapist will progress to the balance exercises, to the advanced functional activities. Implement the exercises which are specific to identify deficits and expected functional tasks. मतलब you have to now come to all those things जिसमें patient को आपको सब वो activities perform करानी है जो वो functionally perform करता है. Maybe sitting on the commode, ascending the stairs, descending from the stairs. Now how you will teach the patient to ascend and descend. Always remember one mnemonic, that is good to heaven and bad to hell. That is when you're ascending the stairs, your good leg, your sound leg should be the first one and your bad leg should be the other one. And when you're descending, that is bad to hill. When you're down, when you're descending from the stairs, the bad should be the first one to keep the step, and then the good one should be there. Okay, very important is robotic joint replacement surgeries. Now, in today's world, you know, the new technologies are coming very rapidly in the medical world. Knee replacement surgeons, they provide a very normal and safe life for many patients. But now the robotic knee replacement surgery is overtaking the conventional knee replacement at a very fast speed. And we at Amandeep Hospital, they are providing robotic joint replacement surgeries, which are incredibly accurate. And surgery basically offers 100% precision is there, and it is also custom fit. It is very accurate for the patient also. The recovery rate is very fast. There is a longer durability of the implant also. It is longevity is very high. That is it is more it stays for the long period of time. We can place the implants in very perfectionist size. There is a minimal bone losses there and leads to a more comfortable knee for the patient also. So what are the benefits of robotic joint replacement? The consistency is there, the precision is there, it is very simplified also, and very naturally feeling results are there. Patients will never feel like that, yes, the knee replaced is there. Safe and scalable, reproducible, and unparalleled outcomes. That is, its results are highly accurate, incredible results are there. There is a minimum blood loss. Stable walking, patient feels very good. There is a minimal recovery phase. It is actually half of what is in the conventional knee replacement. The climbing of the stairs, there is no issue in that. There is lesser muscle strain after the surgery. So after the total knee replacement surgery, patients take a recovery time of 2 to 3 months. But yes, in case of robotic joint replacement surgery, patients will take less than half of the time, and that is very accurate. Now, what is the very minor difference between conventional knee replacement and robotic knee replacement? Of course, conventional is very much effective, but robotic is more effective than the conventional one. In the conventional, only damaged components are replaced. While in the robotic knee replacement, it allows the surgeon that he can even protect your undamaged portion of the joint, which is not damaged, that can also be preserved. So there is a minimal bone loss. X-rays are used in the conventional knee replacement, while the CT scan images, that is computerized tomography scans, are used in case of robotic knee replacement. In conventional, there will be the good alignment, and yes, the good results will be there. But in robotic, there will be the better alignments and very good results as compared to conventional techniques. In conventional, there will be the partial knee replacement, but in robotic knee replacement, there will be the advanced robot will be there who will assist in the technique, and it will be very accurate. So step into the future of joint replacement. First time in North India, robot-assisted joint replacement surgery, which is at the Amandeep Hospital by the Department of Orthopedics, where there is a no bone loss. You will feel better. You will feel better in the faster rate, and 100% accuracy is there. Thank you so much.
There are some questions from It's from Shivani. How do you keep my knees healthy?
Hi Shivani. First of all, I just want to know what is your age?
Age may mention here.
Okay, so Shivani, in the general factor, I would like to say that to keep your knees healthy, you should start performing exercises. Cycling is important, walking is very important. But what I see is that in the parks also when you go, the old patients, old ladies who can't even walk properly, they are still walking. They will be like dangling here and there, but they are walking. That is not a good form of walking. That is actually you are damaging your bones more. So to keep your knees healthy, you should 25. Shivani, if it's your 25 years of ages there, you can just perform the simple knee exercises. You can perform squatting also. You can go for any knee rehabilitation exercises. The general wall squats, you can start from wall squats. Then you can perform simple squats. You can do strengthening exercises of quadriceps, hamstrings, and adductors, which is very important. I've already discussed in the slides.
My father is diabetic and has serious knee pain. It keeps him awake at night too. What should he do to reduce the pain other than going for surgery?
Other than for surgery, if we want to do is, first of all, the quadricep strengthening is very important. The first is knee press exercise you can ask him to do. that is that I have already discussed. Second is single leg raise exercise. Ask him to just keep the knee extended and keep it then downward. Then you can perform it in the sideline position, the same leg raise exercise, and then onto the stomach, the prone leg raise exercise.
My mother is quite overweight. She needs to lose weight but has a lot of pain in knees and so cannot exercise. Is there any diet or medicine?
The very first prior thing I would suggest is to first of all lose the weight anyhow, because if the weight is too much, obviously it will put very much pressure on your knees and you can't do anything. So the first prior thing is to lose weight only. Diet is, yes, you can diet modify, you can reduce the calorie intake. The calorie intake reduction is very important to reduce the weight, and do walking, go for cycling, that is important. Yes, the ligament or cartilage injuries actually they need surgery, but it is they need surgery when it is recommended by your orthopedics doctor, because first of all they will look at your MRI or CT scan images, and then they will discuss about that how much losses there are already discussed through that. If the loss is too much, that yes, the grading is the grade wise is there. So according to the grading, your ortho doctor will see, and if it is too much, then yes, you have to go for surgery. You have to do exercise there, Yogita. You have to do exercise for that. Knee pain, when you are in the prolonged sitting position, that means you will be overweight also. You are not doing any exercise. So simple thing is when you are doing work at your workplace, just take a simple round after 25 to 30 minutes. Make it a habit to always just get up from your chair and take a round. Very important thing is there. Particular diet to be followed for during knee pain. There is not such any diet which is there to be taken for knee pain, but yes, if that thing that knee pain is due to rheumatoid arthritis, which is your guttia, or it is due to the rise in uric acid, that means you have to decrease your protein intake. So don't go for too much of the pulses. Just reduce that, or don't take too much of beans. Rajma nahi khane hai, ye sab cheezein nahi khani hai, and just take these modifications. Otherwise, if the weight is too much, then you have to reduce the calorie intake also. 2 years ago, I had hurt my knee in the gym. I had stayed on bed rest for full 1 month. Even today, I get sharp pain while exercising or running. What should I do? Gopal Krishnan. Yes, so in the gym, when there is a that means you have got injured your knee. So for that, you have to just look for the symptoms. Is the swelling is still present? Gopal Krishnan, I want to ask you: is the swelling is still evident or it is not? If the pain is there while exercising or running, I would suggest to just strengthen your quadriceps muscle first of all, because while running, if you're getting pain, that means your quads is quite weak. Yes, soybean is actually good for bones. It is good, but anything which is in excess, it is bad for health. So I would recommend that yes, first of all, that before going for any diet, just go for dietitian. Whenever I use the stairs, a sound come out from my both knees. Okay, that sound is just because maybe your age is there. So Kishore Singh, I want to know first of all your age. So that sound, that is crepitus. Yeah, so the 51 years of age, so that sound is crepitus, which is called that clicking sound. That is when जब आपकी दो हड्डियां आपस में रगड़ेंगी, जब आप नी फ्लेक्शन कर रहे हैं, जब आप स्टेयर्स चढ़ रहे हैं, उतर रहे हैं, देयर विल बी द नी फ्लेक्शन. तो जब दो हड्डियां आपस में रगड़ती हैं तो आवाज आती है. वो आवाज में भी मेरे भी कभी आएगी, but I would suggest कि if it is too much, then you should go for the ortho doctor and see them. He's a volleyball coach at DCM International School, Firozpur. I would suggest that go for an ortho doctor that is too much. And first of all, the thing is very important that you are a coach and volleyball coach, so you must know about all those exercises. Also, the strengthening, the quadricep strengthening is very important. So, injections are given inside the knee for curing knee pain, and it is very painful. Yes, it is painful. So before going for surgeries, it is important that you should go with the exercises. Therefore, I have told you about all those exercises. But when you're talking about the surgery, we have robotic knee replacement surgery, which is there to help you in the accurate form, in the very precision form also, and it is very quite comfortable, and the recovery rate is very high. Any other queries you can ask? Admit kar do. Sometimes when I suddenly get up from my seat, the gets locked and it feels if I put more pressure, I won't be able to move. Which seat you are talking? That's the toilet seat or the car seat you are talking about, Shahnaz? Okay, so Shahnaz, it is that when you're getting up from the seat, that is the when you're in the lower position, that is when you're sitting on the chair, that means you're putting weight. You're in the knee flexion, your knees are flexed, so you are putting the weight on your knees. So when you will rise up, that will put more pressure. So I would suggest you, you told me that your knees get locked. What is the age, please? 36. Okay, Shahnaz, the thing is that maybe your degeneration has started. I hope that it is not, but so thing is that you should go for the protocols, that is minimum protection phase. I already discussed that the bed positioning, place the pillows, start placing pillows between your knees when you're in the sideline position. Go for protection, like you can perform the simple exercise, the ankle pumps movement, then the knee press exercise, the SLR, which I discussed, the sideline SLR, that is, you will be in the sideline position and then raise your leg upward and then go for in the prone line position, that is, lie on the flat stomach and then raise your leg in the upward direction.
Flex oil, that's for me.
Sorry, I have no idea about flex oil.
Please tell me what precautions should I take to prevent knee pain?
Please mention your age first of all. If that thing is about to prevent your knee pain, the very important thing is keep moving, reduce your weight. 49. Okay. Weight reduction is very important to reduce your knee pain. Impose minimum stress on your knee joint. Keep moving, do cycling, keep walking, and running is not recommended if you that your age is not there, that 49. But yes, the running is also helpful in some cases. In your case, I'll suggest for walking, cycling, and the quadriceps exercises. Quad sets, ham sets is very important. Okay, Ashish, which is better, kneecap or surgery? Ashish, it is not there that which is better, kneecap or surgery. Obviously, the kneecap is just in the very preventive phase. But if your doctor has recommended you for the surgery, that means you have to absolutely go for that surgery only. The kneecap is just to protect your joint from further damage. That will not help you in any way in which the surgery can help. Shanaz June. My mother faced the same, the knee locking problem. Her age is 65. Shanaz, the same thing, the age lock, the knee locking which is there. Your mother has experiences. That is because of the degeneration which is there because of her age. If her age is there, that means you have to just start with those exercises. Again, recommendable to her also. The starting with ankle pumps. Then the quad sets, that is knee press exercise, the SLR, the side SLR, the prone SLR. These are very important exercises that I will demonstrate to you again through the presentation. What about flat foot? Flat foot, mom, sometimes I feel sweat pain in my feet. The session was about knee pain, but yes, I will discuss about that flat foot. If the flat foot is there, that means the knee, it can put very much pressure. It will be the pain in the feet, the pain in the heels will be there all time. So the thing is, Priya, I would suggest you to go with the very soft cushioned heels. That means you should wear the sports shoe while walking. Never go for the heels, please. And the second thing is you can use the silicone pads which are available in the market. You can buy the tan or silicone the pads. You can place it and then you can wear the shoe for the whole day. That will help you a lot. And the third exercises you can do is suppose this is your feet and you can perform this curling of the toes. This will help you a lot. And then you can perform that you can just place a bottle under your foot. Suppose this is a bottle under your foot and then just keep rolling over that bottle. You can just keep rolling and make sure that the water in the bottle should be chilled one, so that it would provide you very much relief. Tell me something for strong bones and good immunity. Good immunity is very much important these days. So just go for the citrus fruits. That is very important. Juicy fruits should be there in your diet. Mushrooms can help a lot. If you are non-vegetarian, go with the chicken, and yes, the beans can help. The blackberries can help. Blueberries can help a lot. For the strong bones, it is very important to perform exercise. The very important thing is to perform exercise. For the strong bones, they can help a lot. Any other queries?
Thank you, Ms. Vora. Ms. Vora, on behalf of the DCM CARES team and the DCM group of schools, we express our gratitude to you for taking time out to be part of our First of the Talk series, which now will be streamed every Wednesday. We stand enlightened and feel better equipped on how best to manage our knee pain for rehabilitation without delay and seek services of a fully trained and professional physiotherapist like you to lead a
Thank you so
painless
much.
lifestyle. Honestly, I myself have been nursing a sports injury in the left knee for the last 20 years and fully understand the importance of what you have spoken today. Thank you once again on behalf of the entire team at DCM Group of Schools.
Thank you so much, ma'am. Thank you.